Good evening, ladies and gentlemen, and welcome to KNDI ATRI Live. So today we're going to begin with a simple question. In a world where we get a lot of health advice online, how do we verify if this information is true, or how do we know that it is not misleading? At times we find ourselves when we are conflicted because we have different information concerning various items, specifically health and nutrition. So today we are honored to have a special guest, Dr. Okeyo David, who's going to talk about medical practice so that we get to understand indeed how medical practice, or basically medical ethics and quackery, how is it important for us to get the right information online? So welcome, Doctor. You can proceed to give a brief overview.
Good evening. Good evening, Laura. I was going to say here that today you have a guest who is the one leading the process of regulation for nutritionists and dietitians in the country. That is the CEO. And I've gotten you very well. I think you want us to talk about the issues of medical ethics as well as what it means in the practice of nutrition and dietetics, correct?
Yes.
Thank you very much. So I want to first of all start by saying that we have had a series of talks about nutrition, and I think today we want to take another angle, which is a bit different from the usual public education.
Yes.
And this is going to incorporate also the component of regulation, which really is the mandate of Kenya Nutritionists and Dietitians Institute. And just to, as a way to start, I want to first say that nutrition and dietetics practice is actually a medical professional area for practice.
Okay.
Many a times people have thought about nutrition to simply means the simple cooking and catering, and so the confusion comes in. But I want to say that the science of nutrition basically is a medical area of practice in healthcare delivery. And if you look at the Health Act in details, it actually classifies nutritionists together with other medical professionals. So it's a medical course. And just like any other medical program or practice, it is guided by principles of medical ethics. And I want to get us on board with really what medical ethics in healthcare practice means, and particularly with a focus to nutritionists, because we realize that this is an area that is not really being taught properly at the university level and even at college level. And so most of the time when we take students through oral examination, we find that they lack that component of medical ethics so that they can form a foundation for good practice when it comes to ethics. I know our professionals sign code of ethics, but the medical ethics has 4 critical pillars which cut across all medical professionals. And I want to mention them today so that our professionals can get to understand it. Number 1 is what we call beneficence. When we talk about beneficence, it means that as a practitioner, whatever you do with the patient, whether you are doing a program or you are intervening, or whether you are performing a procedure that is geared towards correcting any negative health or perception, you must do it for the benefit of the patient. So normally we give priority to the patients, and that is why any program must benefit the patient at all cost, or any intervention must benefit the clients that you are dealing with. That is a principle that any professional must have. The second one, which also is important, is called non-maleficence. Now, when you talk of non-maleficence, it means that as a practitioner, whatever you do with the client or patient when you're delivering your service must be done in a way that it does not harm the patient. Now, there are two types of harms. We have the physical harm, and we also have the psychological harm. Now, physical harm simply may be caused by the kind of equipment that we use. So anything that can cause abrasiveness or can cause injury physically is supposed to be avoided at all costs. Apart from that, we also have psychological harm. Sometimes when a patient discloses information about him or herself or a client, and then you disclose that information and by violating confidentiality to a third party, you can psychologically harm that particular client. And so as a practitioner, you must ensure that you uphold confidentiality, and sometimes you avoid unnecessary disclosures that would cause problems to the clients you're dealing with. So no physical harm and no psychological harm. Now, the third one that also our professionals need to remember and acquaint themselves with is the principle of justice. Now, justice in the medical practice, particularly for nutrition service delivery, simply means that there should be fair treatment of a patient. Now, we look at it from two perspectives. One, you can look at a case where you have several patients. So when you're treating them, you must be just, which means that each one of them must have a fair treatment. There should be no discrimination at all, regardless of friendship, race, or nepotism, or something to do with, of course, wealth and differences and maybe different levels of economic status. Yes. So all patients must be treated equally and given priority equally. Yes. The other aspect of justice is that for every patient or client that you attend to as a professional, they must get value for money, which means that if they pay for your services, then they must also get results out of it. So those are two components of justice that every professional must know. Now, the last one is autonomy. Yeah. Now, autonomy simply means that the patient has a right to make a choice. You cannot force a patient to agree with your procedure or intervention. What it means is that your role as a practitioner is to ensure that you seek informed consent, which means you have to go extra mile to explain to the patient why you want to perform a procedure. But you must know that they have a right to make a choice, whether to accept your procedure or not. You only have a right to seek informed consent. So if they say no, then you can't force them. But then your duty is to try as much as possible to convince them objectively until they reach a point that they now agree with your intervention. Now, these four medical ethic principles are mandatory for every practitioner, including even nurses and medical doctors. But for our professionals who are nutritionists, we want you to get this very clear and have it as part and parcel of your daily practice so that you can get to satisfy the professionalism, because all these things define our integrity and also defines our standards as we say that. I think that is bringing you on board with the medical ethics principles that we intended. Thank you very much.
Yes. It's bringing me on board, and thank you. You've mentioned beneficence as one of the core pillars among the four. So now, based on that, what is your view concerning the dilemma of false nutrition information?
Yes, I think now we can come in on the aspect of false nutrition information, but I want to make it very clear. I just want to have one particular term, which I use most of the time, that is quackery. You see, anybody who is not trained and is not equipped with competencies required to deliver a service, if they purport to try to deliver that particular service in healthcare, particularly on nutrition, they are quacks. And these quacks are not just people who have not gone to school. Even those who have studied other medical professionals, professions, like even a medical doctor or a nurse, who purports to talk about nutrition, if they're not trained, they are quacks. So let me start from that. Now, a quack is somebody who tries to give information without proper knowledge, without proper training, without proper grounding on competencies. Yes. And so because of the hearsay or what they have read in YouTube or what they have gathered from just hearing other professionals talking, they want to say purport or portray the fact that they can deliver service in a particular area. And this has affected nutrition so much because we have seen cases whereby people just walk into media houses, for example, mainstream, or just go into the social media, YouTube or TikTok or any other social media channel. And they want to talk about details of nutrition service, which are very scientific and very critical. And simply because they are in the medical profession or because they have come across that kind of knowledge, they think that they can now talk to the public about nutrition content. The moment that happens is quackery, is false information, because they cannot be accountable for it. They cannot be held responsible for the statement. So I would want to say that quackery has become the norm in the social media. And the dilemma is that the public is here consuming such information without really knowing how to dissect which one is true or which one is false. Now, it becomes a dilemma because some of them are actually spearheaded by medical professionals in other fields other than nutrition and dietetics. And this is where the dilemma comes in. When somebody says, I'm a medical doctor, and they are advising on specific diets or nutrition components, it means people will believe them. The public will believe them because they are medical doctors. But they are actually ignorant because they have no better training in nutrition. Yes. So the knowledge level is low, but they are purporting to provide that knowledge. So that brings dilemma in public consumption of information. And it's also our dilemma on how would we prevent this kind of unnecessary and unwarranted information that goes to the public that confuses everybody, where there is no proper training. So it's a dilemma. And maybe what we can say is that it is now time for us to start thinking, how do we deal with this? Yeah.
Thank you, our viewers. We're going to a short break. Kindly stay tuned. We'll proceed later. Thank you.
Distinguished leaders, innovators, professionals, entrepreneurs, and changemakers, this is to bring to your notice that the Entrepreneurs Leadership Initiative for African Development, ALIAD's Global Leadership and Innovation Conference 2026, and the African Prestige 100 Honoris Awards Gala will now hold on the 25th of April 2026. Venue, Safari Park Hotel, Nairobi, Kenya. Time, 12 noon prompt. Chairperson and keynote speaker, Dr. Ngozi Okonjo-Iweala, Director General, World Trade Organization. Special guest speaker, Professor P.L.O. Lumumba, Chairman and Founder, P.L.O. Lumumba Foundation, and Advocate of the High Court of Kenya and Tanganyika, renowned Pan-Africanist. Dr. Emmanuel Bennett, President, ALIADS. For registrations, visit www.aspirewestafrica.com. And inquiries, call or WhatsApp on 0806 662-6462. We appreciate your understanding and look forward to hosting you. This event is powered by Aspire West Africa.
So congratulations once more for being the award nominee for Leadership Excellence. It's a day from now.
I didn't know that you wanted to bring this on board. Maybe you want to test my feelings.
How are you feeling today, sir?
It's just one day and a few hours just
Yes.
for the award. And I want to tell you that I'm one of the most joyful because this is only the Lord's doing. And it is marvelous in our eyes. You see, to be one of those who are going to be awarded as excellent when it comes to great minds, and particularly on leadership excellence, it's not a joke. And this is cutting across 54 countries.
Yes, 54.
Now you can imagine, this is KNDI CEO and KNDI from Kenya across all the 54 countries. It's a great thing. It tells us that nutrition is leading, particularly when it comes to African, regional, and even to the global extent. So KNDI is actually setting a pace.
Yes.
And the CEO is very happy that we are going to be awarded as a team, and particularly for me on matters of leadership. So I want to really encourage people to be on the watch to see, and if they find anything like this, even in the LinkedIn, let them congratulate the Institute for the good work. Thank you very much.
Thank you so much, Dr. As you've heard it, it's 25th. We are joyful and you're welcomed. And if you find it on your social media platforms, let's proceed to share within our networks so that we become global. So now back to our previous conversation, you talked about quackery. How then can we deal with quackery?
Good. You see, we have an act of parliament.
Yes.
That is Nutritionists and Dietitians Act number 18 of 2007. And this is Cap 253B,
Yes.
which is a whip. You see, within that act, we have under miscellaneous provisions how to deal with those who purport to practice as nutritionists or try to venture into information about nutrition when they're not trained. You see, the moment you go outside and talk about nutrition when you have no basic background in any nutrition science at any level, be it certificate, diploma, or even degree, it means you are already violating a Kenyan law. And so the only way to deal with those who violate a Kenyan law is prosecution.
Okay.
So the law is very clear on how to deal with quacks. The only thing that we are going to make sure that we are vigilant on is enforcement. Because we have tried very well when it comes to public education, warnings, but now it has reached a point whereby we'll have to do a headhunt of those who purport to engage in such violations. For example, the paying a visit to just a media house and informing them that they have to adhere to the fact that whoever sits in the mainstream media to talk about nutrition is a qualified nutritionist. This is something we have pursued with the Media Council. And we have seen some of the media houses are still violating this. Now, I know some of our professionals have even gone ahead to raise complaints with the Media Commission against some media houses. You know, it is a simple common sense, because when you find that you want to pass information, the purpose for media is to make sure that the public, the Kenyan public, and even the global public is well educated.
Yes.
And so when you are bringing somebody on board to talk about a particular issue, which actually is a regulated issue that requires proper knowledge, it is just a common sense so that you just try to find out who is this person, are they qualified, and are they going to add value to our public education. So this is something that the media is ignoring, but we are going to deal with it when it comes to matters of law, because it is a case that can be handled. Anyone who is in the Kenyan land must adhere to the provisions of the laws of the land. And therefore, any form of violation means that you are defiant to the law, and that is prosecutable in the court of law. So we are going to look at, to be on the watch, and I would want to encourage also our professionals that they have to be vigilant. The reason why we have self-regulation is that we can easily identify quacks and report them to the institute together with their locations so that we can follow up. And if we find such cases exist and they are cases that violate our act, then we'll just have to charge them, because it's very easy to just do a charge sheet and get police and arrest these people and then charge them in the court of law. So we are vigilant on this matter, and we want to take it up very seriously. We also want to send a warning outside there that if you know very well that you are not trained, please avoid talking about matters of nutrition which require accountability on matters of science and practice. Any nutritionist that is accountable must be a registered and licensed nutritionist. Now, should you be a nutritionist that is trained and still give information that appears to be false among the professionals, then disciplinary action will have to be taken against you, because you have to give correct information based on what you studied. And it has to be scientifically proven, and it must obey the laws of knowledge and the principles that you were taken through before you were awarded that particular practice license. So that is a sound warning that we are sending as the institute, and this matter will be taken up very seriously, and we are not going to excuse anybody, whether they're in the medical field as a physician or a nurse. We are going to come for you. That is what should go outside there.
Okay, thank you, Daktari. You've all had it, a stern warning. So we've come to the end of today's session, and I know you've picked a lot of information concerning medical ethics and quackery. So same time, same day, Thursdays, 5 to 6 p.m. Kindly tune in. Goodbye from your host, Wangara Laura.
Thank you.